All right. Good afternoon, everyone. Thank you so much for joining us today to this webinar brought to us by Telco, Broadband and Beyond. I'm Dr. Fungisai Majandu. We just have a webinar today based upon health and technology. I think you're going to find it very exciting. Just to introduce myself, so you kind of know who's talking to you. I'm a psychiatrist based in Harare, Zimbabwe. I consult at Annex Perinatal Hospital, and I also run my own practice named Dr. Fungi Majandu, where we try and keep up with the mental wellness of the population. I'm also a part-time lecturer at Midland State University. So I lecture medical students there, again in psychiatry. And then I'm the vice chairperson of Zimbabwe Association of Doctors for Human Rights. That's where my interest and passion lies, in just making sure that the access to health and especially mental health is achieved by everyone in our population. Okay, so that introduces me. And before we go any further, I'd like to introduce Jackie Ndlovu. She's the head of marketing and sales. She's just going to give us a brief chat about the intention that Telco has for this webinar. Jackie, are you there?
Good afternoon, ladies and one gentleman. How are you? Good
Fine,
afternoon
thanks.
to our panelists, and thank you for the attendees. We as Telco are very excited with this opportunity to bring to you yet another webinar. I think it's important for us to, to put across the why. COVID-19 has really changed the landscape in terms of technology. Suddenly now, the technological transformation is happening at a much more accelerated rate. And hence, as Telco, since we're the leaders with the digital transformation discourse, we thought it only right for us to bring these webinars to our audience. This is the first of a 3-series webinar series. Tomorrow we're going to have agriculture. On the 25th, we'll then have our financial services webinar. Thank you once again to our panelists for giving us this opportunity to, to pick your brains in your various fields. Over to you, Doc.
Thank you for explaining that, because actually it's very interesting in that, like you said, the past year with COVID has made it so that all of a sudden I've had to learn how to do, consultations online and things like that. So I'm quite excited to be part of this and to learn from the panelists as well. And so we shall start. Our first panelist is Shiwa Munye. She's coming from Nigeria. She's a lawyer. She does family mediation and e-safety consultant. So this is going to be exciting because she's the co-founder of Wise and Harmless. So it's an organization that sort of teaches children how to maneuver their way in the digital landscape and stay safe. The use of technology, and equips parents as well and educators and the government to make sure that we raise responsible, so not just to raise digital citizens in this age, but responsible digital citizens. Shiwa, thank you.
Thank you. Good day, everyone. Good afternoon. So I prepared a presentation. Should I just go straight into it?
Yes, you can go straight into it. And I'll take this moment to just emphasize to people that you can send your questions to the chat box so that at least we'll know what you want to ask about later. And welcome all the Facebook guests who are here with us. And you may start.
Okay, thank you. Okay. So good day again, everyone. My name is Siwa Moye. Thank you for that introduction. And I would be talking basically on the digital transformation in agenda in the medical sector. So the purpose, as we know, is to help African business leaders think digitally and strategically. Can everyone see my screen? Just to confirm.
No, we're not yet seeing your screen.
Oh, okay. I'm not sure why. Sorry about that. Okay. Okay, are you seeing it now?
Yes.
Okay, thank you. So the focus really is on the primary healthcare sector and the hospitals. And we know that primary healthcare really focuses on the physical, mental, and social well-being. So it encompasses health as we know it, and then mental health as well, and wellness. And then in that, it talks about health education on prevailing health problems. So it wasn't really designed to deal with epidemics or pandemics, but we've had the COVID-19, and we're going to see how that has impacted the health care sector. And then it also focuses on nutritional promotion, including food supply, supply of adequate, safe water and sanitation, and it's based on principles of applying appropriate technology and intersectoral cooperation, so between different sectors. So we see that parts of the industry have severely been affected by disruptions in the value chain by COVID-19. So I just got this, I hope everyone can see it, it's not too clear, but it has the different, the different parts of the value chain. So first we start with the business services. So we see that there is and there have been severe effects to the administrative services. So I've had several experiences with the healthcare sector during this time, not for COVID, but just having to go into a hospital and not being able to access that. I was asked to enroll online, pay before coming in, and I wasn't even able to go in as I wanted, right? So we see how the member and patient services have been disrupted. And this is, I'm currently in Nigeria, and I can imagine different parts of the continent that have also been affected in this way. But we see that, and this was also for a private hospital. And I've listened to several experiences of individuals and patients as well, and those who work in the health sector. And it's been particularly different for the private healthcare and public healthcare, but I'll be focusing on this particular value chain to explain some other aspects. So we've seen that has helped with quality management, but we'll go on to see that there has been an over-reliance and focus on COVID-19 itself. And so if we look at the logistics and supply chain services, especially from the pharmaceutical industry, we see that a lot of the medications have spiked in prices because people are getting more medicines. Many people are turning their homes into pharmaceutical centers, self-treating themselves as well. So I've spoken a bit about payment services, and so research has shown, especially in Nigeria, very few people have health insurance plans. And the question was, would health insurance plans also cover COVID-19 or the effects of it? And unfortunately, it wasn't the case, right? About 5% of the population in Nigeria alone are on health insurance. Others pay out of pocket. And then we've also seen the cost that, yes, COVID-19 did bring funding into Africa, but it did have a lot more cost. And so just going down the chain, we see consulting services have been affected, data analytics, and the software as well. So I go on to say that there has been a positive effect, actually. There has been a boom because the African health tech sector has received increased attention. According to Disrupt Africa, we see that from between 2019 and 2020, the increase alone in health tech funding for startups was 257.5%. That is, an enormous increase. And we see that a lot of funding is going into health tech startups, especially. We have the case because more individuals are also interested in their living well and in having healthy lives. And I got this to show that the technology giants are actually investing their capabilities across the different layers of the healthcare ecosystems. So we see here, like right from the layers of engagement, we see, there's a lot of research, there are a lot of apps now, wearables, Internet of Things. We see Apple, Android, and Amazon leading in this area. And then the layers of intelligence, we see them also wanting to convert data elements into insights and intelligence so that others can be informed in their actions. And then in terms of infrastructure, which is also very important, we also see the push with Microsoft, Google, and AWS coming in to want to impact those levels. So I go on to talk about the challenges, of course, that have arisen, and I call this doom because we did see a drastic decline in provision of essential services for non-communicable diseases. See, a lot of individuals who needed care for things that they had pre-existing conditions, cancer, diabetes, they were not able to receive these health services and medicines due to the pandemic. And, there were a lot of loss of lives, avoidable deaths. So the deaths that could have been prevented were not prevented because people were unable to get medical attention that they needed. So I know many cases of people who were not allowed to come to the hospitals because, they had to do COVID tests first, and they were only attending to COVID patients. Then at some point it turned that, no, you couldn't even come to the hospital at all because we want to make sure that if the patient had COVID, it was not, transmissible to other people. And then a lot of the staff in the hospital, there has been a strain on the staff, especially from the Ministry of Health, because research shows that 94% of the countries in Africa partially or fully reassigned their health staff to support COVID-19, thereby reducing the support for other diseases, non-communicable and also communicable. So I just go on to talk about where and what types of technologies can assist to bridge this gap. So we know that the pandemic has accelerated the evolution of healthcare technologies across the areas of infrastructure, intelligence, and engagement. And there's just several ways that technology can be used to bridge this gap, particularly in terms of the logistics and supply chain improvement, especially for remote areas. We see that there are a lot of tech-driven health insurance programs that are popping up and should also be used. There's also the case of telemedicine, the WhatsApp doctors now. There's more awareness and access to information online, but that also brings into question digital inclusivity because not everyone has access to technology. But in that case, we also see that there's been virtual care and, eventually there will be tools that would help to monitor compliance. Then, of course, of importance is the data privacy and sharing between organizations. So, people obviously have private data, and it's the last time I would just share this experience briefly. I went into the hospital and I could see that, yes, a lot of things were happening with technology, but there were also a lot of doctors on hand to attend to more people because people were not really allowed to come in. So there has to be an improvement in that area. And then we see that one of the ways technology can bridge this gap is through the improving analytical capabilities and engagement with individuals in need of health. More devices, we already have devices, but more devices to track daily activity, well-being, fitness, and nutrition would be of help. And just that aspect of digital and automatic payments and financing. So that's what I have to share. I look forward to hearing from you on your questions and others. Thank you so much.
Thank you, Shiva. Thank you so much for a very exciting presentation. I like how you explained properly what the disruptions have been. And I think everybody echoed your sentiments on how you couldn't walk into the hospital. So she's coming in from Nigeria and she's just given us a talk. And I think for us here in Zimbabwe, which is where I am, it's a lot of what we've seen. So I think it's quite exciting to know that we are still on the same path with everybody else. As I said before, this is a presentation webinar brought to us by Telco, Broadband and Beyond. And please feel free, guys, to put your questions in the chat so that she can attend to them now or later, along with the other panelists. Our next speaker is Dr. Cheru Munutu. She is both a Zimbabwean and an American dermatologist. She practices medicine in both countries. She's a member of the American Academy of Dermatology, the American Society for Dermatologic Surgery, and the Women's Dermatologic Society, and the National Association of Physicians of Zimbabwe. She's a leading dermatologist here in Zimbabwe, and has been providing a lot of excellence in the provision of medical, surgical, and aesthetic dermatological services. Dr. Munro, welcome.
Thank you so much. It's a pleasure and an honor to participate in this forum. And of course, I'm coming to this as a clinician primarily. So my background is, of course, being a clinical dermatologist. I do work in the public sector, and I'll talk about my experiences there. I don't have a formal presentation like our former speaker, but I just have some talking points to the main questions that are framing our discussion today. So I sort of moved back to Zimbabwe in 2016. And at that time, I joined the faculty at the University of Zimbabwe. So I do teach part-time medical students dermatology, and I work at the outpatient clinic at Pharmaceuticals Hospital. So the first thing I would say, the first question that we were trying to answer was that what parts of the industry have been severely affected by the disruptions in the value chain by COVID-19? I would say the entire value chain was disrupted. From our experience at the hospital, the pandemic had impact in two main ways. So the first major impact it had was that traditional service delivery really became impossible. We actually were shut down at Pharmaceuticals Hospital, the outpatient department, once the pandemic had sort of people understood how serious it was. We actually shut the whole unit down. And up until now, outpatient dermatology at Pharmaceuticals is not yet fully operational. So you can see that it's been a year since I've seen some of my patients who relied heavily on that service. So that's one way. And unfortunately, when you think about all the players in the value chain, from the big payer, which is usually government, and being a government hospital, the government is the largest payer, but obviously their priorities had to be reorganized. And so non-COVID priorities certainly fell off the list, because we obviously were not able to share PPE that was already very scarce with people who were really on the front line at the hospital. And initially, when the pandemic came, our hospital was not a COVID center. It was not a place where patients could access COVID care. That was Wilkins Hospital. So over time, as the pandemic shifted, as we saw the seriousness of the effects, within Harare, more and more hospitals came on board to sort of either reconvert wards or separate wards to have red zones and green zones. And the red zones are obviously where the COVID positive patients were being taken. So this is one way that was a really major disruption. So the second thing I would say is that even in terms of us as clinicians being service delivery folks, a lot of us who are no longer actively participating in internal medicine, we're now being called upon by our colleagues to sort of help in this pandemic, which I'm sure, Doc Fungi, you can imagine, is very scary if you haven't done internal medicine for a while to lean back on your old training in order to, service patients. So that was another concern. The other concern, if you look at the service delivery chain, if we look at, other providers, so pharmacies, people who are in wholesale trying to bring goods into the country, a lot of that was also interrupted because people could not import maybe at the same levels they could have imported certain goods into the country in order to make sure that PPE was adequate in our hospital settings, in order to make sure that certain medications were accessible to the population. So those are other ways in which, we experienced breakdowns in sort of our service delivery and our supply chain and value chain in healthcare. And then I would say at the bottom of that, the consumer, the end consumer, was consumed with panic. You know, if you really think about it, a lot of people had fear about going into the doctor's office, going into getting care, because they were afraid that they would contract this horrible disease, you know, if they were to step outside their homes. So I would say in my situation, even though I stopped initially offering in-person consultation, I did end up introducing a telemedicine platform where people could dial in and we could have a video consultation. Dermatology, fortunately for me, is very, very much amenable to video consultations because people can then show me their rashes and show me what's going on with their skin. However, even in this sort of pandemic, I would say the uptake of that technology was surprisingly slow, because I think people still, not that they don't have digital literacy, but still, it's still not the traditional way. People want to sit down with their doctors, have their condition explained to them in a face-to-face manner. But certainly, I think this whole situation that we're in has certainly accelerated perhaps the acceptance of digital technology as a method of service delivery. The other area to continue on that theme of service delivery over technology is that you would find that the payers, so the fiscal intermediaries in our systems, medical aids, the people who hold the purse strings and pay the doctors, unfortunately were sort of struggling with how do we pay doctors for these telederm services. Oftentimes, you know, people want to WhatsApp their doctor, but you know, how then does the doctor then claim reimbursement for those services? So these are some of the very interesting things that have come from, you know, the situation we find ourselves in, and how to integrate technology so that payment systems work. Because then I would find that a lot of providers would then, even though, you know, providers that are older might have some digital literacy limitations, but I think they would be more willing to engage with technology, you know, if some of those situations are cleared. The second question, you know, where we ask what challenges have arisen due to the lack of value chain coherence. So some of those challenges, I think I've already alluded to, but I think the one challenge that I would say was really severe was this payment slowdown. So I think even from a government perspective, where budgetary priorities have to be reorganized, you know, this put challenges all the way down into the system, into non-COVID areas. For example, in our maternal child health, we actually suffered a lot of maybe perhaps preventable or unnecessary losses because payments towards those situations were not taking place. So in our PPE was scarce, women were not presenting on time for delivery. And so there were losses that were done. And I think this was covered in a recent paper by some colleagues here in Zimbabwe about how COVID has impacted in chronic health in non-COVID situations, or even in maternal health sector. So that is a large limitation. And then, of course, when you think about some of the other challenges, besides people here in the urban areas, you have to think about all the people across the country, maybe folks who live in rural areas. What is their true access to these technologies? So that does then provide a digital divide between the haves and the have-nots. And whereas we might say, yes, you know, if we look at away from healthcare and we look at mobile money transactions, Africa is really leading in some of those areas. But how can we make it really simple on a basic phone that's not necessarily a smartphone to access care? So those are some of the ways that I think we need to think about. You know, these are challenges that we need to think about, because oftentimes a lot of the technology solutions involve needing to have advanced technology in a way, a smartphone, a phone that can do video links and things like that. And how do we take care of people who are not quite there yet? And then, of course, when we look at the last question, where and what types of technologies can assist to bridge the gap? Again, the technologies, you know, thinking about what technologies can we use. Technologies, I think, across Africa are really changing. And I think we have an opportunity to leapfrog over some of what the Western countries had to go through in order, you know, to come forward, because I don't think we have the time and the resources. So we have to find African solutions, African solutions that work at our local level. I think one of the limitations sometimes is that one of the limiting things is that there's limited content in our native indigenous languages. A lot of things are in English, even if you want to think about the smart, the apps that are out there to ask the doctor about certain things. These are all in English, and sometimes that can be a certain barrier. So that's one thing. Local content for local people, so that we can increase the uptake, because sometimes I think digital, switching to technology can be a bit intimidating, especially our older patients who, have it hard enough using their EcoCash app, let alone trying to see the doctor or to access healthcare over an application. I think these are the main things. And with COVID-19, I think it has provided an opportunity. So, I would agree with the earlier panelist who spoke, saying, yes, there has been a boom in the technology, but I just hope that we can harness this technology and make it accessible, because again, there already is a rich and poor divide in Africa that's quite severe, the haves and the have-nots. We have a very young population, I think, that is very willing to engage in the digital transformation of our society, of the way we interact with each other. So I think these are all opportunities that we need to look forward to in the future.
Thank you very much for that. You had me excited and scared at the same time. I think it's just that I've got a really pretty background, but I'm in my office and I think you're in your office too. So this is definitely the advantages of technology. You can see your patients and take a break and engage in these discussions that otherwise, when you're busy at work, you have to drive out and you can't risk, to say, I'm going to go and drive out for 2 hours. You miss out on things. So that's exciting. But the scary bit, like you said, is that as the technology is moving, we have to make sure that it's accessible to all of Zimbabwe, that it's accessible to all of Africa, that we don't leave people behind, especially when you mentioned that how much are they actually participating, can they then do a WhatsApp call with their doctor? Do they know that they can, and how do they pay after? I think these are all things that we're looking for solutions for, and I think Telco is leading that question for us today, so that we may find solutions together. And because doctors are not so great at technology and their patients, but that's why it's important for us to link hands with this digital landscape so that we move forward together. I'm going to just remind you all to answer the poll question. I think you saw it. Please do give us your answers so we know how you feel about telemedicine. I wasn't allowed to vote, but I feel that it's great. Because as a psychiatrist, I can do teleconsultation. So I think it's also the question of which realms can fully be sort of encouraged by the digital age. Like for psychiatry, I think, and you said, Dr. Munro, dermatology, you're very comfortable to see that rash and you can diagnose it. And I think a lot of people don't know that. I myself was quite impressed. So I'll send you a picture of a rash later on today that I need a consult on. It's not mine, just for a client. So we're gonna have our next speaker, and then after that, we'll take a bit of a break. So our next speaker that's coming through is Cheo. So Cheo Charai is, he's a friend of mine. Sorry, I got a bit confused because I know she's a friend of mine. So she's started a company called MedForce. She's the CEO Africa. They provide medical tourists in the sub-Saharan region with medical value travel services. And she's the director of CJV Medical and Laboratory Supply. She's been an entrepreneur and doing this for 8 years. So she's an amazing young lady. She's just gonna talk to us a bit about the disruptions she's also noticed in the health sector. Are you ready, Terry?
Yes, I am. Thank you very much, Fungi, and thank you to Telco for hosting us and encouraging this very good, discussion on the digital space. So, like you said, I am founder and director of MedTours Africa. So what MedTours Africa does is we facilitate for anyone who needs to travel outside the country for medical purposes. And the reason for travel could be that the treatment sought is not available at all in the home country. Sometimes it's because the local options are pricey. And rarely, but sometimes you also get people who just want to travel for treatment because they can. Like it's a matter of choice. So come COVID-19, travel was restricted. So we had patients who had lined up to travel through Med towards Africa. And we also, I'm in a few groups who had scheduled their next of kin, parents who had scheduled their children to travel for medical treatment, on philanthropic grounds to Italy, to India, to South Africa. But as soon as that lockdown happened, it meant travel couldn't occur. So it didn't matter what kind of travel you were supposed to partake in, whether it was luxury or medical. So you found that just stopped overnight. And then when the travel restrictions then lifted, you also found, because they started lifting slowly after about, 3-4 months, but you found that the destination countries themselves were trying to handle the burden of disease that they had. So South Africa was busy trying to handle COVID in South Africa. The hospitals were filled to capacity. India was also similarly trying to contain, infections to make sure that the spread of the virus doesn't go, and they don't import any foreign strains. They just were protective of their own citizens. So even though travel restrictions were then lifted, you had destination countries, and our main destination countries for Metros Africa are South Africa and India. So we had about 9 months of people who couldn't travel. So that was business shut down. That was loss of lives. I think from especially up until December, the losses of lives that I got to find out, which were not because of COVID, were more than the COVID-related deaths. So I remember the first speaker spoke about that, and that was really heavy to experience and to see. Italy was just, reeling from the impact, and that was a huge disruption. When I'll also talk about, we don't really do local medical travel, but I'll speak about it because it also impacted Zimbabwe. So our 2 referral centers, the main ones are in Harare. We've got Pharmaceuticals and we've got Harare Hospital. So because the lockdown happened in such a way that even local travel was restricted, you had patients who were not in Harare needing to travel to Harare who couldn't. So there was loss of lives there. You had people who, even when the restrictions were now lifted a bit, but needed to use public transport because they don't have, the private vehicles or access to them. They couldn't travel to just get treatment, to get seen by the doctor. And unfortunately, the have-nots, which Dr. Munro was talking about, they are there. So you had people who could not even WhatsApp consult anyone, who couldn't get advice over WhatsApp, over Zoom or anything. And it also impacted how someone who could have got treatment for a minor, I say minor, I don't have any medical background. So you had people dying because of treatable conditions, really. We also had the impact, of healthcare staff. So let's just say Pharmaceuticals was operational at full capacity, but they couldn't because the staff implications were that, one, the staff were going through their own process of having to deal with COVID, having to protect themselves, shortages of PPE. The government, I think they now then got donations, but initially the government was really struggling to get adequate PPE to just protect the healthcare workers. So understandably, you sit down with your friends and they're scared. They're expressing their fears of going in to help, even though they might want to help, because they don't have adequate protection. And that speaks to also supply chains, because if the supply chain was smooth and good, then you would have those things being shipped in. But there was disruption of freight services. The flights were not moving, the ships were docking, and then the PPE was not arriving on time. And I think digitally, so I'm going to just touch on the three questions haphazardly. So digitally, how we could probably solve that is to have the systems in place. I know I was on the Ministry of Health and Child Care website, and they're talking about, LIMS, logistic management information systems, of getting that in place so that the supply chain is sorted out. And that's how technology can be used, so that hopefully there's not going to be another pandemic soon. But if that happens, we need to make sure we've got X amount of supplies, which will last us, for X amount of time. On the supply side, because I also run CJV Medical Supplies, on the supply side, there was chaos in pricing of commodities. One day you order from China, and you know what COVID highlighted was also how manufacturers are concentrated in certain geographies. So if you get gloves manufacturers mainly in Malaysia, and Malaysia decides they're shutting down their borders, then you're going to have a very big shortage of latex gloves. And that's what happened at some point. You're going to have, if masks are mainly being imported from China, and China initially just said no to exports. Totally, they just shut down and said, we're not exporting anything because we need it. Then the prices on the market were just ridiculous. I remember before COVID, we used to sell 3-ply surgical face masks for $3 a box of 50. At one point, that same box of surgical face masks went up to $50 for one box, and that just shows how, and I think digitally we can try and start manufacturing. I know there are the costs involved, cost of labor, electricity, the overheads, but digitally we could look into ways of manufacturing locally. 3D printing, for example, for the ventilators, it's amazing how other countries have picked up on 3D printing and are starting to do it. But unfortunately, we haven't picked up on that in Zimbabwe, and I'm not sure about other African countries, like how much the uptake has been. But we need to be open-minded enough to embrace those technologies so that we're not heavily reliant on other countries. And I come back to the medical tourism. I don't think there's a reason why, as Zimbabwe and as other African countries who might be tuned in, we can't start developing centers of excellence for ourselves so that we attract more inbound medical tourists than outbound. We need to be in a position where we can treat our own patients. Like I started the service because I realized the need. I experienced the personal loss. So I didn't start it just because for the sake of taking food off the doctor's table, I've been told once. No, that wasn't the reason. There's a gap in the market. I think Zimbabwe has a lot of skill, good skill. You can just look at the States, you look at the UK, and you'll see the number of doctors, Australia as well, the number of Zimbabwean doctors who are practicing there. So it's not a shortage of skill. I think more than that, it's a shortage of the techno advancement, that equipment, and constantly upgrading and updating our infrastructure so that we can actually treat the local patients and invite other people to come in. It would definitely help with the loss of lives. I was talking about the healthcare workers as well. They experience their own losses. They experience shortages of PPE. Oh, there's a pop-up there, but I can't vote because I'm a panelist. They also had to be split from their families. And I say that because, I'm involved in one of the projects which Dr. Fungi is doing of supporting the healthcare workers who work in the red zone. So when they're on duty, they're actually physically separated from their families. And I think that there's an emotional and psychosocial aspect, a negative one, which affects them to say, okay, so I'm sacrificing, I'm 1 week on duty, right, at Parenyatwa, but I don't get to see my family, I don't go see the milestones my child is experiencing. And then at the end of that week, I have to go back home. So even though I want to go back home, am I not exposing my family to the risk that I've just been exposing myself? So it's all that support. Digitally, I'm sure they can do with some airtime and technology, and just to keep up to date with what's going on. And I like that online, there's some training which can actually happen, and that's how we can use digital means to help the healthcare workers. Why don't we get training to just upskill themselves done virtually? I know there's a company, my CPD, ZW, it's a friend of mine, they're offering CPD points virtually. So they actually started the initiative before COVID because they wanted to reach out to the medical personnel who were not in Harare, but who sometimes missed the opportunity to upgrade themselves. And they started this platform, and it's such a no-brainer now that you should be able to have your CPD points from where you are, from your home, because it's knowledge you're getting, it's information. I don't think they do anything practical. Correct me if I'm wrong. But so those kinds of initiatives are what we need. I can't talk enough about telemedicine. And this concept has been there for ages. It's kind of a good thing that COVID highlighted it to these doctors and to the authorities that it's not a bad thing to actually use telemedicine to treat, especially when the patient doesn't need to physically come into the rooms. I've been attending many conferences, especially in India, and I remember at one point there was a discussion of, is there a future to brick and mortar hospitals, especially for things which, for consultations? And it's just an ongoing debate because some people still feel that even if I can send you a picture of my rash, Dr. Munutu, I don't want to see you because I'm paying for it. That's part of it. But because of that face-to-face interaction. So I think we're moving to that, to concierge health, where if I need to see you, why should I still come to your rooms? Why can't you come to my house? Why can't we navigate in such a way? Because I understand your rooms are there, but I'm thinking as a patient that people who go see you are mainly not well. So if I come there, I'm risking myself and contact with other people who are not well. Instead of you just coming, you're already at risk. Thank you for putting yourself at risk. You're already at risk because you are seeing those people. But if you come to my place and if you're able to treat me from where I am, then it means the risk for me is lessened, And telemedicine is also when people are traveling. We have hospitals now offering pre-consultations before someone actually travels, and then post-consultations when people come back. The danger to that, though, I like the WhatsApp doctor, which was mentioned before. The danger is, as a patient, who is going to tell you who's the genuine doctor or not? Because unfortunately, there are devious people out there, and you could just get a Dr. Cheucharai who's from India all of a sudden saying that they're doctors and they can consult you. And that's a scary part. And I think that's why regulators have been really reluctant from before to regulate international. Let me know when my time is up for you. Please, just go. Yeah, but yeah, so I think just in conclusion, on the telemedicine part, I do agree that regulators need to make sure it's in line. But I think there are digital ways and digital means which can be used to make sure it's done ethically. And there's always the option of using reputable organizations like Mid-Towards Africa. But yeah, thank you. I'll wait for questions later on.
Thank you so much for your presentation. I found it very funny and interesting. And I think what you're talking about in terms of the digital safety, I think that's what Shiwa Munye does with her company. When I read it, it was making digitally safe children. And myself, I thought, wow, she doesn't know that we need it. So I think you're very right in what you're saying, that a lot of people do need that direction if they're going to enjoy it. The same way that Medpros provides, you can't, it's not like just going on holiday. You can't say, I would like to go and be operated in Malawi, I leave tomorrow. So I think that's things that people need to uptake and understand about medical tourism, that is organized. And you have to go somewhere where you know it's a reputable doctor who can take care of you and has a plan for follow-up after. So that allows for telemedicine. Thank you for that, Joe. I think we are excited that for now your business is a bit slow. So us doctors on the ground can see your people. As you said, you may not be the friend of a lot of people, but if you start as well, the way you said, by telling people that what do you call it? Travel medicine, tourism, medical tourism can be the other way around. I think I've never really thought of it that way, that if we become excellence in our different fields, people will then travel to us for health. So it's something that you can look at, bring us the clients from your different countries. I think we're going to take a break for now, just a short break. Telco, Broadband and Beyond is going to show us a short video right about now. Please keep the questions coming. We've seen the questions that you've posted so far, and we'll definitely attend to them. And again, thank you all for joining us today.
Welcome to Telco Health Technologies. We work with health service providers to bring affordable healthcare using technology. The WHO defines health technology as the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems to solve a health problem and improve quality of life. One of the biggest health issues that Africa faces is the efficient delivery of cost-effective healthcare to poorer or marginalized communities. Imagine healthcare where key vitals can be checked, recorded, and sent to the remote doctor within a matter of seconds over super-fast broadband. Imagine a consultation with a skilled medical practitioner that can be conducted remotely using the latest medical or audio-video conferencing technologies. Imagine medical records that can be stored electronically and unlocked using a one-time PIN when the patient visits the medical center. Imagine medication scripts that can be transmitted from the doctor directly to the pharmacy and dispensed readily when the patient appears. Imagine a patient medical history that can be stored securely and only accessed by approved medical practitioners using a one-time PIN that's sent directly to the patient's phone. Speak to us about how we can help you as a medical service provider to reimagine your medical practice. Telco Health Technologies, health reimagined.
Thank you for that video from our sponsors who are Telco, Broadband and Beyond. I think we're just going to move quickly forward if everybody else is back. So we have the rest of our panelists, people in different fields. It isn't just doctors who actually are going to speak to us today. So our next speaker is Nyari Muguti. She's the Chief Operating Officer of the Pulse Group. The Pulse Group is an integrated healthcare company and is serving healthcare professionals on the care continuum by making mission essentials become accessible. Nyari, welcome.
Thank you. Afternoon, everyone. And again, thank you to Telco for hosting this webinar and the series that follows over the next 2 days. So as Dr. Majandu said, I am from the Pulse Group. So we are an integrated healthcare company and we serve professionals. So we have 4 companies essentially. So the first one is Pulse Pharmaceuticals. We're a wholesale pharmaceutical. So we provide pharma products into pharmacies, hospitals, clinics, so right across the country, and industrial clinics. Our second company is called PAM Pharmaceuticals. So this company sources and imports Indian generics. So import generic medication into Zimbabwe from India. The third company we have is called Pulse Surgical Care. So anything you need within the hospital setting, so within ICU, within wards, within and within anyway within the hospital, we supply the equipment. We also supply the consumables. Then the fourth business that we have is called Pulse Technologies. And that's where we specialize in providing testing and diagnostic equipment to laboratories. So when we say we support professionals across the healthcare continuum, we're looking at if someone needs to go for COVID testing, you probably all have been tested, using one of our machines that we've supplied. If you've ended up in hospital, if you ended up unfortunately on a ventilator, if you've used a concentrator, if you've used a nebulizer, we provide that as well. And obviously, if you've gone into a pharmacy and required medication, we supply those pharmacies. So it was really interesting listening to yourselves, the doctors, and yourself, Chair. You are really on the front line. So I bring a different perspective in terms of our biggest area is supply chain and logistics. So you can imagine with COVID-19, and I think everyone has touched on the points in terms of the impact on the supply chain. But from our perspective, we really felt it because remember, we bring in the stock to provide into pharmacies, and all of a sudden there was COVID-19. As much as possible, you want to carry maybe stock for 3 months, your fast lines, we operate a just-in-time system. So you can imagine if the supply chain is impacted, it leaves us quite exposed. And also we're unable to, in terms of service delivery, we can't supply our clients, we can't, and obviously everything that we do, the end user is the patient. So we always think about that. As much as we serve the professionals, at the end of it, there's a life, at the end of that supply chain. So we don't take it lightly. We had a lot of sleepless nights in terms of the supply chain. So I think one of the first things that I'd highlight from a pharmaceutical perspective is we import probably about 85% of the drugs that we use in this country. So you can imagine with COVID, if borders are closed, it's a huge, huge impact. And again, we work with forecasting. For instance, if we're bringing in our medication from India, sometimes your lead time is 6 months. So if borders close and you've got a lead time of 6 months, that 6 months becomes 9 months, it becomes 12 months. So there's a real impact in terms of in terms of the stocking and satisfying the market. So a couple of points in terms of the supply chain. So the first thing was South Africa, where a lot of our medication comes through, even our medical devices, a lot of them come through South Africa. The South African government introduced SAHPRA permits. So medication that didn't need to be registered, all of a sudden had to be registered. They had a new process that wasn't fully communicated. Even our suppliers weren't sure how to actually use the process. A lot of the people administering the system, the SAHPRA system, were working from home. So there was initially a lot of confusion in terms of, how do you get these SAHPRA permits? How long are they going to take? What's the process and the impact on, on the supply chain? So that impacted our suppliers. And I'd say that a lot of stock that we would have expected in March only started to come through about May time. Started coming through in May, started coming in June. So you can imagine if we had ordered stock that we expected in March, it meant April, it meant going into May and possibly June. And here we are, facing a crisis. And all medication that comes into Zimbabwe is registered. So you can't even go somewhere and quickly bring in something, to satisfy, the requirements and the demands. So because we follow the regulatory framework that's been set up by MCAZ. So, and then the second thing, when we talked about the borders closing, so we also bring in PPE. So all of a sudden the demand shot up. So again, your forecasting literally goes out the window, because everybody wants PPE. All of a sudden, banks wanted PPE, schools wanted PPE. People that ordinarily did not use PPE, everybody, even any office worker, all of a sudden needed PPE. So again, a huge challenge. You try and source as much as you can, but everybody is working with a forecast. So even if we go to local suppliers, the demand on them and the requirements literally shot up through the roof overnight. I talked about importing from India as well. And I think one of the panelists also talked about that, importing from India, importing from China. So China closed its borders. So whether you had stock coming or not, it wasn't moving. It wasn't going anyway. Same thing with India. The stock, wasn't going anyway. So you can imagine the challenge in terms of, you actually feel powerless in terms of, what can you do to get stock out of India? And you realize for now, there isn't a lot you could do. The good thing is that our borders were still open. So when we could still get some imports from South Africa that hadn't been impacted, but I'd say most of our product had been impacted. And then those suppliers that were willing to, send us product, again, the challenges was trying to find flights. So there wasn't a lot of flying, there wasn't a lot of cargo movement. I think one of the airlines like Ethiopian continued to operate. But if you think of most airlines, their fleets were grounded. All of a sudden, the demand again for space, the demand for flights, for medical equipment, for pharmaceutical products was high. At the same time, there was an increase in freight costs. So you've got demand, you're facing increased freight costs. The stock that you're expecting to come to sell to our clients negatively impacted our working capital cycle. So all of a sudden the capital that you would have gained by selling that product, assisting you to then order the next batch of medication or of devices, all of a sudden you didn't have that. So it was a real, significant challenge, within the sector. So governments, by closing borders, everyone moved to a very protectionist policy. So everyone was looking after number one. And I think one of the things that we recognized is that as a country, it does expose us because we're so dependent on those supply chains. What is it that we actually make in Zimbabwe? And I think one of the good things that came out is I'm sure everyone's seen that a lot of the universities started to actually produce PPE, and that started to ease some of the burden, particularly within the government institutions, the hospitals. But I think on a wider basis, there was still, a lot of demand. And I think in some cases, you ended up having runners come in. So we're using the official channel, the regulated channel, but there's someone who can bring in gloves, PPE, by whatever means necessary, which again left us exposed. So I'd say those the first 3 months for the wholesale pharmaceutical, anyone in the supply chain was severely impacted, and it was very, very, very difficult. I think one of the other things that, given that I'm in operations, so supply chain is important, but the infrastructure of a company is very, very important, because if you don't have your own internal infrastructure as a company, you actually can't deliver. So we had lockdown. It meant that a lot of our teams were now working from home. Unfortunately, we had the infrastructure where our teams could work from home, whether it was our pharmacists looking at the regulatory requirements, whether it was our telesales team and sales teams in being able to call from home and VoIP. And all of a sudden, they can't go into the market. So what you'd see is demand for products has gone up. COVID products would go up. All other products, because of lockdown, people aren't going into the pharmacies. Essentially, the demand for those products, went to rock bottom. So, for example, products that you'd find maybe prescription drugs, for your eyes. People weren't going to the doctors, weren't necessarily getting scripts, and it wasn't an emergency. They weren't buying the product because they probably needed a script for that. So you'd find that what we did as an organization, so if I touch on the digital aspect, so they say that luck is about opportunity meets preparation. So we had invested in our own, and we're still going through it, a digital transformation in terms of how do we show up our technology within the organization. So we didn't know that a year later, this was going to happen. But when COVID happened, we were able to seamlessly ensure that our staff were then working from home. We could still communicate with our suppliers, whether it was by email, by phone. It also meant in some cases that we had to buy data for our employees. So it wasn't just easy to say, okay, work from home, but we needed to understand, what does work from home look like, for you? Do you have electricity, for one, before we even think about data? Do you have a dongle, for mobile data? If you do, great. If you don't, then we need to make sure that we get that for you. And then following that, then you're able to do your job and you're able to, to deliver. So I think that's, very important for any organization supporting the health sector, that you have to have your own strong infrastructure, you have to have your own strong system to enable delivery, to your clients. Then the other thing that we did when I talk about digital, so we, across the 4 businesses, we bring in a lot of new equipment that's cutting edge. Which means that we have to engage with a lot of doctors. We also engage, if we're bringing new drugs into the company, we have to engage with pharmacists. We have to train them and, and take them through the process so they understand that. We previously used to have meetings, so face-to-face meetings, maybe at the Meekles, or attend, Zima meetings or Retail Pharmacists Association meetings face-to-face. So all of a sudden, we couldn't do that. But we still had product that was coming. We also had COVID, new lines that were coming. Sorry, I just need to take the poll off. We had new lines that were coming, into Zimbabwe. How do you communicate with your clients? Yes, you've got WhatsApp, but you actually have to train them. You actually have to tell them, you actually have to show them how, certain equipment works. And that's where we started to use Zoom and we started to use Teams. So engaging with the retail pharmacists, engaging with pharmacists to say, there's we have this training, it's available. In some cases, buying data for them, just to make sure that they can attend those seminars. And the same thing with Zima. And initially, I think it was challenging because it was new to everybody, even etiquette online, put your camera on if you can, be on mute, don't show us your ear, all those things. So I think, judging by what I can see today, we all get it in terms of what the online etiquette, but it was over a period of time that we got there. So now, we attend a lot of Zima seminars, Retail Pharmacist Society, of Zimbabwe, a lot of that, and we are running some ourselves. So for us, we had to make that switch. And even when we started to tell our suppliers in South Africa that this is what they were doing, they were quite surprised and they were impressed, because they kept saying to us, well, how are you going to launch this product? How are you going to communicate it? How are you going to train people? And because we already had, our online seminars, for us, it was more the logistic side of things, because we were already able to run these CMEs. So I think one of the things that's important, within a transformation, is we have to be able to adapt, and adapt quickly in some cases. So COVID forced a lot of, a lot of people to accept technology that maybe they were ignoring or didn't think was important. And all of a sudden, it happened to you and you had no choice, and you had to take it on board. But I think one of the things that I have found very heartening and encouraging is the way Zimbabweans have taken technology on board, moved to telemedicine, moved to, to WhatsApp. And so I think that's awesome, but I really do think that we still have a way to go. And I absolutely agree, digital is important, but behind that, there's a backbone, there's the infrastructure that makes, that digital aspect work. And I think that's very, very important from my perspective. And so I think from my perspective, I'm just making sure that I covered all my points. And, I think I have, but again, as I say, digital is key, because if you're not digital, you will be left behind. I think that's the reality that we're facing. So it's a choice, but the market has gone, the doctors, everybody has engaged. So don't be the one, left behind as technology progresses. Thanks, Doc.
Thank you, Nyari. I think you gave us some really key points. I think the emphasis, like you said, on infrastructure, just like Chiu had mentioned, a lot of the things that were lacking in terms of our healthcare during this time were not the personnel, was not the staff, it was the infrastructure, the things that make it happen. So I think we need to focus on that. And I would like to work for your company, FYI. You guys were prepared, as you said, you can never
Come talk
prepare
to us.
enough. I'm coming. You can never prepare enough for a pandemic or a disaster, or that's what it is. It's a disaster, it's an accident. No one can prepare enough. But I think the emphasis that you made, that because you were prepared a bit and supported your staff, and made the transition much smoother. You intimately knew how people were living, what challenges they had, even in terms of Zesa, because we take that for granted, that you can just use technology without knowing that somebody has to have these things and they must be supported. I know Dr. Munuti had mentioned that there's a lot of advanced age people who struggle with technology, and I think it's so true. I'm not advanced in age, but I struggle with it too. But I think it emphasizes the word support. Then we need to be able to support people and walk them through it. I think a lot of people are embarrassed when you're on a Zoom meeting for the first time and you don't know what to do, and people say to you, mute, and they can send you all the messages, but if you don't know where the mute button is, you don't know. So with that sort of support and just being comfortable to say, I don't know how to do this, I think a lot more people would take up technology, would be more comfortable with these services that are provided. Okay, so thank you for that, Nyari. We'll have questions for you as well later. I think our last speaker is Tawanda. So Tawanda Tawana is the lead IT team lead at WellTech Solutions. So WellTech Solutions was founded in 2008 with the strategic decision to focus its attention on medical, retail, technical service provision, incorporating the setting up of a hardware and software distribution. So it's the same thing that I think I just complimented Nyari for. This was founded in 2008. It's an IT company and it's focused on medical resources. So that means that they also anticipated that health should move with the digital time. Tawanda, are you here?
I'm here,
you
thank you.
Thank you, welcome.
I hope you can hear me clearly, yeah?
Yes, I can hear you.
Great. First of all, I'd like to say that it's quite an honor to be on the same platform as you guys. I mean, it's so amazing, and I find it really inspiring that you ladies are taking are on the forefront of pushing technology ahead. So it's quite amazing. So I'm very honored. So thank you very much, Doc. Right. So yes, I work for WellTech Solutions, and I'm the IT team lead. I lead the daily operations of our company, and make sure that everything is in order. So WellTech Solutions is an IT company that provides technology solutions for health practitioners. We're talking pharmacies and doctors. So, and also we also do hardware. We also supply hardware as well, like your computers, laptops, and all that stuff. So we plan to make our agenda is to make life easier for health practitioners through our solutions or through our software. So right, I'll go straight into the discussion. Right, I've got three perspectives, guys. I've got a user perspective, I've got a consumer perspective, and I've got the neutral perspective. I totally appreciate what all of you guys were saying, and it's, what can I say, unfortunately, or rather fortunately, I'm caught in between the whole conversation because I'm like, the solutions provider. But, in the end, I've got three perspectives. So the first one is the consumer perspective. I'll speak from my own personal experience of, how COVID-19 has affected my life and, impacted the way I operate as an individual. We're talking of, I was never used to wearing a mask, it's a very huge change. I mean, like, every day you're walking without a mask, then one day you're told, hey, you're supposed to wear a mask every day. That was a huge change for me in my life. And, but, unfortunately we had to embrace it as well, and there are also issues of self-medication, this issue of COVID-19 has brought in a lot of, innovations from people, especially here in Zimbabwe. You have to drink zumbani, and, and you, and you also had to do all that kunatya, you had to steam every day, and, and there's this, one of my major fears was, I wouldn't want to call myself a frontline worker, but, I guess I was at some point, but imagine having to go to a client, contracting COVID, then going back home and infecting your family, and it's such a sad scenario. But that was one of my fears as as just an individual, and also there were cases where we would buy stuff out of fear, like you buy a lot of medication just to stock up, because you fear that anything can happen, so that is my perspective as an individual, or as at the low end of the chart. So looking at the challenges that we faced, as an IT person, we are talking of operating times. Most of our clients, there was a law that we were supposed to operate up until like 3 p.m. And that are not, that was a very huge disadvantage to us, because we know that most of our clients start getting most of their traffic around 5 p.m. And and especially when everybody's under lockdown, there's not going to be any traffic at all. So that was one of the disadvantages that we faced as an organization, and that also affected like the whole chain, the whole value chain, and it was that was a very big disadvantage. And also talking of price hikes as well, prices were inflated to crazy amounts, and in Zimbabwe being a multi-currency environment, you have people paying local currency and USD, and some people were just inflating prices. So that was also a crazy experience and a crazy disadvantage. And we're also facing logistical issues like getting one item from here to the other place, and that was I think also contributed to the fact that you couldn't be traveling, and you're not allowed to travel. You had to have like some form of letter to be able to pass through the roadblocks, and it was just crazy. And also billing as well. The billing of services was hard, because sometimes you wouldn't get your payments in time, and we're looking at a case whereby most people were working from home, and many companies didn't have the infrastructure to accommodate their remote workers as well. So billing was one of the major drawbacks that we experienced as an IT services operator. And I'll speak also from an IT perspective. I think for me, this was actually the positive that I faced. One of the positives that I faced. I mean, like for IT, I feel like there was a big boost in business. To be honest, it's quite a it's quite a crazy point to say in the midst of a tragedy or a pandemic. But I'd like to say that we experienced quite a big boost in our business, being a solutions provider. We had so many practices. Like I said, we work with pharmacies, we work with wholesalers, we work with doctors. So there were many people operating, even though it was tough, but you find that people were actually looking for solutions where they could keep the patient records, do like electronic claiming, and send SMSs to their clients for their reminders, and for also repeat prescriptions. So I think those are all the other services that we're actually looking at from an IT perspective as well. But one of the challenges that we faced is that most of our suppliers were banned, or there were some restrictions on, you couldn't actually supply some hardware. We couldn't get hardware at that moment in time. So we had those challenges where, you want to set up a new project, but you didn't have access to the hardware that you need to actually, set the client up. But on the other hand, we had many of our clients using like the contactless payment platforms that we have. We have integrated eco cash transactions, where you don't have to hand someone your card or anything. You just have to take your phone in, put in your number, punch in your number, and the whole transaction is deducted. So we had so many people using those platforms as well. So for us, it was actually a good, a very great advantage. And also on the other hand, payments were slow because you had your back-end operators working from home, and sometimes they would have challenges commuting to work to process the payments as well. So yeah. So the other thing as well is that our clients, most of our clients have no infrastructure. In technology, you need infrastructure above all. We're talking internet access. We're talking your servers. You're talking you're talking the knowledge base as well on how to operate the infrastructure. So that was one of the major challenges that we faced as well, because many people in Zimbabwe are used to doing things manually, using paper and pen. But in this case, you just had to embrace technology, but the infrastructure was a problem. And we also face resistance from users. Bringing a new thing to someone is somewhat of a challenge, and I totally appreciate what Dr. Fungi said. Doctors really need to embrace technology. Yeah. But it's. I think we're moving in that direction where slowly, at one point, all of the doctors are going to have to embrace technology. And also, you'd find that during the COVID period, there was a loss of staff, like staff members and manpower. That was, you had so much work piling up on you, and that also mentally contributed to an already existing disaster of the pandemic. So it impacted negatively on you. So if you had so much work and you're worrying about your family and COVID, it was terrible. It was a terrible time. And also, I think Dr. Fungi mentioned something about having power, which I also attribute to infrastructure as well. So I think that being said, I'll move to what we might need to do going forward. I think we need to embrace digital payment platforms. We need to embrace more on and invest more on digital payment platforms. We need to invest more on mobile payments, and also I feel like from can I say a governmental level, we need to apply laws that embrace technology. We need to put in certain laws that that will make life easier for people. Because one of the challenges that people faced from a neutral perspective, I know I could look both sides, the pharmacy side and the consumer side. From the pharmacy side, you couldn't dispense medicine to a client. There are cases where you can't dispense medicine to a client if the client is not there. You get it? So that is actually a challenge, eh? I think the law needs to change and actually accommodate cases where you can actually send your medicine via email, your prescription via email or via an app, and they can just deliver your medicine. So I understand here in Zimbabwe there are so many laws that are so crazy, and it's looking at it from a progress perspective, it draws us back, and we need to work on that and change the laws in Zimbabwe. And Also, you'd find that elderly people are not really tech savvy. They don't really know how to operate their phones. They don't really know how to operate apps. So perhaps we need to conduct some trainings. I don't know what kind of trainings or how best we can apply that, but we need to, enable our elderly to be able to use apps, phones, tablets, computers. And also, we need to find ways to give access to people in the remote areas as well. Dr. Fungisai mentioned something about infrastructure. If we can get fiber to Zarabani, I think that's a good thing there, because also at the same time, they need pharmacies, eh? They need pharmacies, they need doctors, So I think via the internet, life is made easy. I'm not sure if I missed something, or I'm not sure if I tried to exhaust all my points. So thank you.
Don't worry, Tawanda. You can't exhaust everything, and it doesn't matter, because people are going to ask you their questions. Even myself, I have some questions. Firstly, I'm glad you had a productive financial year, regardless of the reason. The fact that you had a productive year means that a lot of doctors or medical personnel were uptaking these resources, which is a good thing. So it is a good thing that people are moving forward, because whether or not they were prepared for this situation, I mean, the pandemic is going to end. Exactly. And when it ends, you also need to have digital solutions for the change that would have occurred. I think people don't think about that a lot. They're like, okay, we were already caught unawares, not knowing that actually we can be on top of what happens next. And I think this is what Telco and broadband, Telco, broadband and beyond are trying to teach us today, that even if we miss a certain wave, we can get ahead of what's going to happen next, because the world has changed. The world has changed how we communicate, how we conduct ourselves, how we learn, and this affects health as well. And I think it's important for us to be ahead. So hopefully all of you have been answering the poll questions that have been popping up on your screen. I'm not allowed to answer, and I was a bit jealous in the beginning, but some of the last ones that came through, you've answered.
No, I can't.
We can't answer.
I can't block, eh?
Yes, and the worst bit, the last ones that came across, I actually was glad I couldn't answer, but the answers should be interesting. So I'm just going to ask our panelists the questions. They're all here. And so the questions will depend, I mean, who answers will depend on the specific question. The first question we have is, how effective is telemedicine? And is it being actively used in Zimbabwe?
Can I answer that?
Yes, you can start, and we can allow others as well. So how effective is telemedicine, and is it being used in Zimbabwe?
Okay, so I think that telemedicine is the only way we can find out how effective it is to look at the other people who are actually using it and how they're using it or how they're implementing it. And there's no need for us to reinvent the wheel. We just need to follow what the other guys are doing. And I feel like it's quite effective. It cuts costs from the consumer perspective or from the patient perspective. It also makes life easier in terms of interaction or accessibility. You have access to, speak to a health practitioner. You can, send them a picture of a rash, like what you guys are saying. But yeah, I feel like telemedicine is very effective. It just depends on how we implement it. Thank you.
Dr. Monucci, do you have anything to add? Since I'm assuming you've used it, how happy have you been with using telemedicine?
Sure, yes. So in my field, we call it teledermatology. So telederm, the short form, is a very, very good way to interact with patients. And really, in our field, there's two ways to do it. So the first way, we call it store and forward. So that's when a patient would take good pictures and forward that to the doctor. And then that gives the doctor a time frame to get back to the patient and dispense a treatment. Or you can do it over video. So, in my preference is sometimes to do it over video, but I think I found it quite challenging in terms of video quality, because sometimes things are pixelated, you can't see it very well. So it's really hard to make a definitive diagnosis that way. So I think there's certain parts of medicine that are very, very amenable to over the video or a store and forward type of format, particularly for dermatology. But I think in other sort of, maybe if you're a general practitioner, if someone had a cold or could describe their symptoms to you, I think it can be useful. But there is a challenge with telemedicine in that, you can't listen. We don't yet have the technology for people to listen to the heart, to listen to someone's lungs, to do an abdominal exam. So that is more advanced technology, even though I do think the advent of wearable technology, so some of the devices that we use, like the iWatch or Apple Watch and the Android watches with applications that can monitor heart rate. I think blood pressure, they're still definitively working on, because blood pressure on the wrist is actually quite hard to measure accurately versus blood pressure that's done on the upper arm. So there are still ways that technology needs to evolve. So I don't think you can totally eliminate an in-person visit, but certainly for sort of minor medical ailments, things that could be easily treated without exposing a patient to other very sick patients, I think really can be done. Then there are things that are impossible. You cannot, unless, you dialyze people at home, you can't do that telemedicine. People will have to go to a dialysis center and things like that. So, there's still technologies that need to be developed for other more advanced aspects of medicine.
Yeah, so that actually answers the follow-up question was, is it still effective if you can't do, like your BP, temperature check? I think you've answered that by saying that you can still have devices that provide that information, but depending on the field, definitely you need to touch your patient depending on what you do. And then for us in psychiatry, because we do teleconsultations, these are possible, especially if you have a long-term client who you, like some of my clients I've known for years, and we have a comfortable relationship. It's like this, it's a video call, Zoom, WhatsApp. We can still get the nuances of the non-verbal communication. Yeah, so the video chat would be better. So you need good data and things like that. But I think it is, and it allows for, at least in psychiatry, when you have clients that you see for a long time, but they move, university students, maybe they've traveled for their semester, you can't just start a new relationship with a new therapist. It is difficult to force that relationship. So you find that maintaining that client and supporting them during the time they've traveled for whatever reason has become easier. And it's actually, for me, I find it very exciting because now I know what's happening at school as it happens, than when they come back and I have a 3 months review of what happened and what they didn't cope with. So yeah, and I think that's good. The poll actually said that 79% of the people here would utilize telemedicine. So maybe it is the providers who are not offering it more if it's not being done. Another question, sorry? Yes?
Just a final comment. I was going to say, what could also make it easier for us to see patients would be then to be able to dispense the treatment. For example, Zimbabwean pharmacies still want to see a stamp on people's prescriptions, that type of thing. It's really archaic. Yes. We should be able to then electronically prescribe medication. So the next step made easier. So definitely, I think it's working between patient and a physician or provider, but still the next step of then having the treatment discharged to the patient is still, I think, a little bit challenging in our environment.
Okay, yeah, and so you're saying yes.
Just to add on, I think another aspect of telemedicine which we could use in Zimbabwe, especially for the stations which are outside Harare, because specialists are concentrated mainly in Harare. But what you could do is, if there's a clinic in the outskirts or in another town or city, and there's medical personnel there, so if there's a nurse on duty at a certain clinic, we could also use telemedicine to have that communication between the specialist who's remote, actually talking to another medical person who's looking at the patient in person. And there's a concept of electronic ICUs as well, because sometimes the personnel who need to manage the ICUs are not there because of the numbers of intensivists in the country or whatever other specialty. So if we could have the nurses on the ground or the clinical technicians, the people who are not the specialists but are medically trained, actually interface with the patient, and then the information they can relay on a professional level to a specialist or somewhere else. I think that's an aspect which we could definitely use more of in the country.
Right. I think you really explained it. So the sharing of information would actually even reduce the need for, again, medical tourism, because you can get specialists as well, not even the flow of information necessarily from like a specialist to a nurse, but specialists sharing information across different countries. And I think that's definitely can only help us, can only help everybody. So does anyone else have to add, or you speak as we go along? I'm just going to post another question and come in when you
Oh, you want
can.
to say something, Yari? It's okay.
Yes, I was just going to say, so I think all the panelists have, really talked about, what we need to do and what's there. But for me, what struck me from the question about how effective, and I think Tawanda touched on it, we've got to start before, we've got to start figure it out before we see whether it's effective. And we have to then figure out what model works, so as Dr. Munro was saying, for Telederm, it's a slightly different model to maybe Dr. Fungi with your patients, which you might have a relationship with. So we actually just need to do it and then figure out what works, for the different areas and the different sectors. And then at the same time, again, to Tawanda's point about the policy side of things and the regulatory, because you can't do any of this in isolation. You can have a great idea, but I think anyway, where technology has really flown, you'll find that the policy and the regulatory environment and the legislation has supported that, and has allowed the tech sector to grow. So, for us to be able to do that, we have to take the MCAZs and, all the registration bodies and take them on this journey to demonstrate the benefits and also how you manage the risk. So it's a great idea, but again, there's a lot of risk. And then how do we then communicate the benefits to the patients? How do they feel safe? So, I think for certain consultations is easy and the patient will feel safe, and in some cases they wouldn't. So again, what regulation do we put to ensure that the patients are safe and we've managed that risk and make sure that we can deliver for them? And then at the same time, from the doctors, from the clinicians' point of view. But I think, again, and I talked to that point about how COVID came and it accelerated digital adoption. So I volunteered with Solidarity Trust Zim. We set up a call center. So it wasn't strictly telemedicine, but it was along those lines. And one of the things that we found is people were actually phoning, they didn't have information and they wanted to speak to someone. So I think the demand is there. We just need to start and then engage with the right regulatory bodies, and take them on that journey.
How would you also sort of, I'm thinking like, especially in my field, but for a patient's sake, feel safe as well includes privacy. I mean, when you go to the doctor's rooms and the door closes, you know that this is your time, but now you're in a forum like this. And I mean, okay, like this is being recorded, right? How do you know if somebody's going to report you or the pictures are going to move around? WhatsApp has been having a field day with people who send audios. So can you imagine if somebody's sending me an audio with a conversation and next minute they see it in their church group? I think a lot of patients may be concerned about things like privacy. And how do you secure these spaces? Like what sort of tools do you have in place that you can utilize so that even when I get information, it's me and my patients are the ones conversing and I'm relaying back information to the correct person?
Or I'd like to step in and try and answer that. So I do think, from a policy perspective, privacy has to be paramount. In America, there is a law called HIPAA. People can lose their jobs. They can be deregistered as physicians, as nurses, as techs, as whatever, if they allow private patient information to escape their control. So it is something that has to be very, very serious because, Zimbabwe is a small country. Harare is an even smaller town. Everybody knows everybody. And so I don't think that it's very professional to allow patients a patient-physician type relationship information out of bounds of that consultation. So I do think there's a legal framework that needs to go into it. And then secondly, for me, there's informed consent. So when I see a patient, if a patient wants to record me, they have to inform me and ask and basically request for the consultation to be recorded. But it's my expectation that some patients won't do so. So at all times, I'm always trying to give, reasonable and effective education. So if my voice is heard elsewhere, I wouldn't be saying anything that's out of bounds. But I do think that it's part of the relationship with the patient. It's part of having that informed consent that if you're going to see the doctor, you want your patient information to be private and confidential. And I do tell my patients that, because sometimes I have to photograph lesions or photograph rashes to see if they're, evolve and resolve, so that we have documentation in the patient's medical chart. And it is a very valid question. Some patients be like, oh no, doctor, don't take pictures of me. I don't want that on WhatsApp. And I have to explain to them that, no, I am not that person who put your images on WhatsApp, because this is a confidential and a private, consultation. So it is partly education on their part, but I do think that as we move forward in the digital transformation of our society, we are going to need, we're going to need the legal framework to handle things that then go wrong.
Okay, thank you for that. I think we've actually partly answered a question that was a follow-up. It just spoke about what support could government give toward this movement, support its citizens to get much more affordable. If not, okay, that's different. I thought it was also just policy, but the question is asking how can government help so its citizens get much more affordable, if not free access to internet. I don't think this is pertaining to in life in general. I think this is pertaining to the portals that you use for health, to say that if you have a service, can somebody get on it at a cheaper charge? That would be like a free call or something like that. Anyone got any answers or thoughts?
Dr. Fungi, if you don't mind me speaking, imagine a case whereby you don't have to, you're just wearing a wristband, and you don't have to go to the pharmacy to have your BP checked and have temperature checks and whatnot. That wristband just automatically sends all that information to your doctor, and it comes up as a pop-up on the screen, and she can actually read it, and find out how a patient is doing. So we need to look at things from that perspective, and the only way to enable that is to make the internet cheaper, to make to make data cheaper. We need to provide the infrastructure. I feel like all this whole conversation, we won't go anyway without mentioning addressing the question of infrastructure. We still have to invest a lot in the necessary infrastructures that accommodate for all that to happen. But I feel like life could be made much easier, and I mean, imagine if your wristband could just detect that you've caught COVID. You don't have to go for a test. You just have to know that I have to go into quarantine. So
that's a good point. But they also speak to a bit more money, like a smartwatch. Like, is there a way that if somebody wanted to have this sort of like a WhatsApp consultation or call, is there a way that you can tap into it so that the specific one for health could be cheaper or something like that as we move forward with the advancement of technology?
Well, there are ways around those things. I know for sure that you can, if you could actually let some certain traffic go through the network if you want to. If it's a certain app that you've opened, you can allow it to go through the network and reach the servers. So there are so many ways you can do it. You might not have data on your phone, but the moment you open an app, it can be allowed to transport information. And also in terms of security, we have things like encryptions, firewalls and stuff like that. So yeah, I totally agree with what Dr. Cherry was saying as well, because at a policy level, it's something that needs to be, it comes from the top going downwards. So it never comes from the bottom going up.
They have to be emphasized, and they want to make the noise. Thank you again, Telco, Broadband and Beyond, for this opportunity, because I think this sort of murmurings or the noises we are making already about things that we may need surrounding health and technology are the ways that can start from the bottom up, in a way, as in for people to know that we need to make sure that anyone who releases information does get the full rest of the law. Will make maybe patients feel a bit more comfortable. There's another question that I've just seen. It says, how can we advance use of AI and IoT in the health sector in Africa? An example given is to do a remote op, as is now possible in the first world. Any thoughts on that? I don't know.
I think.
You can go first.
Okay. No, ladies first. It's okay.
You will wait forever, but yes. Dr. Munro, your status, yes.
Okay, so it's okay. So what I was going to say, I think with artificial intelligence, you know, in Africa, we're still, I think, lagging behind. I think healthcare sector in general lags behind because I think there's still a lot that needs to be done with the humanism of medicine. So the human touch, coordinating that with artificial intelligence algorithms. Even though I think when we look purely at machine learning and the ability of machines to be quote unquote perfect, that their perfection is only up to the limit of sort of human knowledge, if that makes sense. So we have to feed the information that the machines need to learn in order for an output. So for example, in dermatology, we look at people's, what we call moles, the common layman's term would be moles. We look at nevi, they're called melanocytic nevi. And these moles can accumulate mutations that lead to melanoma. So melanoma is a skin cancer. There are algorithms that have now been put into computers where computers you can take a photograph of a mole, feed it into the computer, and the computer will give you a readout of whether or not it thinks this mole is malignant. So there are ways we can enhance technology, but even if you look at those computers, they do still make errors. Sometimes, yes, some things can be done finer than a human eye, but then there's also intuition, years of experience of looking at moles and trying to decide which one could be abnormal, and also the feedback from the patient. If the patient has information for you about the mole, has it been itchy, has it been bleeding, and so there's some things about the human aspect of medicine that needs to be captured appropriately for artificial intelligence, I think, to really work. But when it comes to the Internet of Things and the connectivity of all our devices, I think that's coming along. I mean, you look at big international corporations like, Samsung and what's it called? I forget the other one that makes fridges, the Korean company. If you look at that, they're coming out with fridges that talk to your television, that talk to your watch, that talk to your house lighting system. So I think that's coming. There's going to be a lot of ways for data to be dumped into a device to be able to give a health outcome, basically. But I think there's still a lot of growth that needs to come to Africa in order for those things to happen here. And it's still a steep curve for us, I think, resource-wise, with limited resources and that type of thing. Not that we don't have the talent or the desire, but I think it's really going to be resource limitations and aligning some of those priorities. But I do think we can leapfrog over what a lot of the West has gone through and, launch ourselves into the future if we sort of make it a priority.
Thank you. Anyone else on the panel?
Yes, Dr. Funke, I just wanted to add to what Dr. Munro was saying. So when I look at AI and IoT, so, very advanced, and I look to where we are in Zimbabwe, I think we're fortunate because we, everyone else, let's say the West has done it before us. Mm-hmm. So we can learn, and then, as Cherry says, we can leapfrog in the development step, the development journey that they've gone through. But we always have to ask ourselves, is the solution right for us? So I know I keep going on about, adapting, but first off, we always have to make sure that the solution is right for us. We shouldn't just take something and say, let's just do it. Because we know that AI, IoT, there's a lot of investment. So from a funding perspective, it's very expensive. So by asking if the solution is right, it means that you're actually going to invest in the right solution for what your need is. And it should really drive things like effectiveness, and improvement, and things like productivity, and even the quality of care at the end of it. So is it the right solution for us? Does it give us a better outcome than what we currently have? And what is it actually going to cost us? And a lot of it is quite expensive. But if we have ticked the first two boxes, means that it's much, much easier to then go and, if you need funding, whether it's from NGOs, whether it's from Global Fund, from the private sector, and you tell a good story in terms of what the outcome is, is going to be. For instance, you're going to use AI and IoT at Parenya towards the biggest referral hospital in Zimbabwe. All of a sudden, you know that you've got the volume. If you bring in this machine that connects, with IoT, you can diagnose your patients, treat them, they can go home wherever in Zimbabwe with a wearable, and you're constantly tracking the data, which means that they don't have to spend money to come to Harare every 4 weeks or, every 6 months. So the health economic story comes into this. So that's very, very important. I love technology, as you can tell, but I always labor the point, it must be right for the problems that we face here in Zimbabwe.
Thank you for that, Nyari. Sure, you have a comment?
Yes, I actually wanted to add to the previous question and to this, and once again, I want to thank Telco for putting this together and to commend every one of us here, especially the panelists, because it's important to know that these are challenges that cut across Africa and the world as well. So the other two sectors I work heavily in, education and legal sectors, they're, it's the same debates. How much of AI do we implement? But we have to keep innovating in technology because we recognize that technology is here to stay. And the question, particularly on digital inclusion, because you have particularly people in the remote areas who sometimes get badly hit by diseases, and they also need to be educated on well-being. Yes, traditional methods work very well, but there's always improvements and innovations that we can build upon. So in terms of inclusion, digital inclusion, there needs to be strong partnerships, particularly I took some notes here with the private sector, and it would keep improving and growing, but there has to be that transparency, treating digital inclusion with as much transparency as possible so that people can trust that, that data is being kept private and safe. And just as much as they're keeping themselves safe, their information and the technology they're using is also getting safer. So yes, we're going to get to where the other countries are in terms of AI and robotics, but I can give you some examples. So in the health sector in Nigeria, we had in the education sector, we had the ministries of education in different states giving devices to the children so that they could continue with education. So, some parts they would get radios, other parts they would actually get phones. But in the rural areas, they weren't getting the text messages we were getting almost every day from the National Center for a Disease in Nigeria telling us COVID-19 is real. What if those text messages were actual wellness tips? Instead of instilling fear, we could have been instilling healthy living into society. And the same thing with the legal sector, where in terms of legal aid, we're making sure it's automated now so that people can call in to numbers or use the USSD code if they do not have access to the internet to access legal aid. So those are other sectors that I know there's so much being done in the healthcare industry, and I do commend the workers, especially those on the front line. But then there's also so much that we can learn from other fields, and also that strengthening in partnerships. Thank you.
Thank you, Chiu. I think that was actually a very good example that you gave us, that as much as we're talking about advancing in terms of health, you can look at other industries. If it's been done there, health is just a business as well. In some senses, it's the business of health. Actually, I was a frontline worker giving mental health sort of assistance to those in the red zone. And if it wasn't for the ability to do it online, I probably would not have done as much as I did. In terms of it's scary, and you can do more work if you're actually able to do it in one spot. I didn't have to drive out every day. So definitely, I think there's allowance for a lot of telemedicine. Any other questions? I don't see any on the chat. I'm just going to give you the results for our polls. I don't know if I think they popped up for you, but in case you didn't see them. So a lot of people on this group actually would go for medical tourism. So I think you would be interested to know that a lot of people do like the idea that you can pick and choose where you want to go to be treated for various reasons. And the reason why people feel that we may not necessarily become a hub of medical tourism anytime soon, so it doesn't mean ever, ourselves, is infrastructure. And I think that's the conversation we've been having a lot, is that there's a lot of lack of infrastructure, both in the digital space and in the health space. I think I can't see any questions now. Yes, so I'll read the last poll was asking about if your company currently has the requisite internal infrastructure and systems that allow employees to collaborate even when they are not in the office. I think that's something that Nyari had highlighted. They had started at their offices. 69% says, yeah, it's well established. So that's good to know. And the last question being, do people think that we're going to ever go back to what we were before COVID? It was pretty much 50-50. 50% think things will settle in, and 50% think things will not change at all. I'm going to read a comment from Chiazam Gucci. It says, the biggest thing we can leverage is experiences from other countries, tap into the diasporan experience of working with these advanced systems. And she completely agrees with you, Nyari. It should not be copy and paste, but rather understand understand the locale to then innovate and pivot as appropriate. Okay, so that's exactly what Nyari was saying. Yes. The last question on the poll, I've read those. I think there are no more questions. Yes. So I think I'm just going to thank Telco again for this chance to have this spirited discussion. And thank you so much to all the panelists. I think you came in with from such a different angle that it was quite interesting. I've always thought about health, obviously from my end of view, which is the provider, but it's nice to know what the consumers are thinking, what the support of health is, and where we can all help each other grow. I think we should have more of these webinars to see how to assist each other, and possibly one aimed at a lot more doctors, just so they can feel comfortable to know that their data will be private, and that, as Dr. Munuchi said, no matter how much we advance, there's always going to be room for the doctor. I think that's what makes people afraid. People fear that technology will Robocop its way into taking over everything. Yet I think the idea is how you can use it to better the experience for your patients, for your clients, depending on which way you refer to them. Jackie, do you have any words just before we leave?
Yes, thank you, Doc. Some amazing insight from our panelists. Thank you so much. Thank you so much to the attendees that put through questions. Just a note, us as Telco have invested heavily in the provision of primary healthcare. We want to, by 2025, have at least 100 neighborhood clinics or centers that will provide primary healthcare. But we cannot do it alone. We need the help of you as health practitioners and anyone else that wants to partner with us to make this vision a reality. And just a huge nugget from Nyaradzo Mguti. Let's localize our solutions. So local technology for local problems. And, you know, there can only be one partner, Telco. Talk to us. We can make a plan to make things happen for you. Thank you so much once again. We look forward to seeing you tomorrow for the agricultural seminar, and then also on Thursday for the financial services one. Have a great day, and thank you so much for the participants and attendees. Over to you, Doc, just to wrap it up.
Yes, I wasn't going to attend the other sections because I was like, I don't have a farm, but definitely after
we insist on seeing you. I'll be waiting for you. All of you.
You absolutely will. After listening to this, I've actually really seen that unless you look at technology across all the board, you might
Yes.
miss out. So I'm very excited to join you tomorrow because I'm sure there'll be solutions for me as well and my little garden. Thank you, everybody who joined us here on the Zoom webinar, and to those on Facebook. The video will be made available by Telco, so thank you to them. And I'm sure those who want to get it will be available for you. I hope we all see you again tomorrow and the day after. Have a good afternoon. Bye. Thank you to all the panelists.
Thank you. You're welcome.
I want to hear thank yous.
Thank you.
Thank you.
Very much.
Thank you.
Thank you.
Thank you, Doc.
No, really, thank you guys so much for the amazing information. Have a
Best
good day.
moderator ever. We love you. We'll be calling you for the next one.
Bye. Have a
Thank you.
good day.
Cheers.
Thank you.
Right. I'm trying to log off.
For you to log off, I'll log off last, as is polite. Well, before Jackie. Bye.